focus on two drastically different ends of the spectrum. Hospitalizations and death on the one hand, mild symptoms and quick recovery on the other. But I'm here to tell you that the distance between these two extremes is massive. And that's where long COVID lives. And having inhabited that space for the last year and a half, take my word for it, it's not a place you want to be. Long COVID is real, it's random, and it's characterized by periods of remission interspersed with intense symptom flare-ups. It can take many forms. And for me, that meant months after my diagnosis, I still couldn't walk around the block without getting lightheaded and needing to lie down, struggling to breathe. I was 23 and had just come off the back of 4 years of Division 1 college athletics, training 2 to 3 times a day, 6 days a week. And now I had such debilitating fatigue that I sometimes couldn't even get out of bed. These days, a relapse can be brought on by something as simple as walking the dog or going for a kick of the footy. The physical impacts are lessening over time. I can now go through long stretches where I'm mostly okay, but I'm still nowhere near normal. Long COVID takes its toll in many ways, and it's the invisible impacts that mentally weigh you down. The shame of constantly having to tell people that you're still not better yet. The frustration you feel with your own body that you just can't seem to get over this post-viral syndrome. And the constant fear and anxiety that at any moment the symptoms can come back. I know there are many who have had things far worse than I have, and I'm definitely not here to cry, poor me, because in many ways I've been incredibly lucky. Instead, I'm keen to do anything I can to help get the vaccination message out there. It doesn't matter how young you are, it doesn't matter how fit you are, and it doesn't matter how indestructible you feel. COVID can still hit you. And you don't have to be on a ventilator to have your life turned upside down for months or maybe even years. Why take that risk? There were no vaccinations available when I got sick. There was nothing I could do, nothing any of us could do. I felt so powerless for such a long time. But we're not powerless anymore. We can fight back. And we can now protect ourselves and those we love. We can get vaccinated. Thank you.
Thanks, Will. Good morning to you all, and thank you, Premier, for the opportunity to come and share my story as a COVID survivor with you. My name is Kim Hanrahan. I'm 49 and I live in Newport with my husband Dave and our 9-year-old twin boys, Sam and Charlie. Late last July, my husband and then I contracted COVID from our house cleaner. We were very careful and stayed upstairs while she cleaned downstairs, and then vice versa. She wore a mask, as did we. Although Dave had asthma, he was fortunate enough to only get mild symptoms. A few days later, I started to go downhill rapidly. By day 11, I continued to be bedridden, unable to sleep with body aches and pains that not even strong pain relief could mask. I couldn't finish a sentence without difficult breathing. I didn't know if this was as bad as it was going to get, but didn't know how it could get any worse. It was during my daily COVID call with DHHS that I was unable to talk properly. They thankfully realised how unwell I was and advised to call an ambulance straight away. With a very low blood oxygen level, I was taken to Footscray Hospital's emergency department. I was put on oxygen and given fluids, steroids and medication to help combat the disease. I went into ICU for 6 days. So lucky not to be on a ventilator like so many patients around me. My lungs had collapsed and I required constant flow of oxygen. I was regularly on a machine with an invasive full head mask with fast flowing air. COVID also stripped me of my dignity, unable to go to the bathroom or wash myself. I had to rely on the amazing kindness of the ICU nurses who cared for me at their own risk. I'm so grateful to all of them, especially those who'd gone from 9 to 5 jobs to retrain for the ICU ward's punishing 12-hour day and night shifts. I thank them for their altruism and the sacrifice on their personal and family lives. After ICU, I then spent nearly a week isolated in a hospital room as my blood oxygen was still very low. Again, looked after by amazing staff, head to toe in uncomfortable PPE for very long shifts. Every day, I desperately hoped my health would improve so I could go home to see my beautiful boys. My husband was solely looking after them in isolation, which took a toll on all of them. We were lucky enough to have great community that would drop off food at the front door. When I got home, I was still unwell and had to isolate, which was hard, but I was home. Recovery was slow. A couple of months after leaving hospital, unexpectedly my hair started falling out and I lost about 3/4 of it over a 6-week period. This temporary hair loss was due to the trauma my body had gone through getting COVID. And now? Pre-COVID, I had no underlying health conditions and was a reasonably healthy woman. 14 months later, and I feel like I've aged 10 years. I'm still feeling the long-term effects of COVID. My fitness has been severely impacted. I have brain fog at times and fatigue, taking a lot more effort to do the same daily activities. I feel a lesser version of myself due to this horrible, debilitating disease, which makes me sad for my boys. My message to you: we are so lucky in this country to have access to vaccines and great health care. If I'd got the Delta variant before vaccines were introduced, I truly don't know if I'd be standing here today talking to you. Don't play Russian roulette with your health or of those you love. Please get vaccinated. Thank you. And I'll now hand over to the Premier for questions.
Talk about very dark moments in your life, but there's a theme now. No one wants to get this, and beyond that, our amazing nurses and ambos, the whole team in our health system, they do quite unbelievable work. They are extraordinary people. By getting vaccinated, you take some pressure off them. By getting vaccinated, you make their task just a little easier. It's going to be very challenging in the months ahead, but all of us can play our part in supporting those health system heroes by going and booking an appointment today. There are indeed thousands of them available.